Today is World Parkinson's Disease Day, and it is a day earmarked every 11th of April to support about 10 million people worldwide with the disease and to also create awareness for the disease. The theme for this year's 2022 is integrated healthcare, and according to health experts, the goal of commemoration of this day should be to improve the quality of life with appropriate care and management of the disease. World Parkinson's Day marks the birthday of Dr. J. Parkinson's in April of each year. On this day, there are efforts made to increase the public awareness of the disease, as well as all the good work put forth by the world's organizations that are dedicated to preventing and finding a cure for this debilitating disease.
To further commemorate this day, a board member of the World Parkinson's Coalition and advisor for the Adewumi Desalu Parkinson's Foundation, Omotola Thomas, joins us to create more awareness about the disease and care for those affected. I want to say thank you very much for joining us today. And I must say that certainly Parkinson's for people like me was made popular by the plight of Muhammad Ali, the famed boxer. And you look at that and say that is the knowledge about Parkinson's, especially here in Nigeria, do you think a lot of people are aware of the disease and what they can do to probably care for it?
Hello, thank you very much for having me. Just a quick note to your producers. I can't see anything on the screen, just an FYI, so it's hard to get the feedback. But I'll answer your question. No, I don't think we have nearly enough awareness of Parkinson's disease in Nigeria and in other parts of Africa. And you can tell this by the level of misunderstanding and misconceptions about the disease, both here in Nigeria and across Africa, and the high level of stigma that is associated with Parkinson's.
So, Omotola, I'd like to know what age group is most vulnerable to having this disease, and what are some of the symptoms to look out for?
So, the biggest risk factor for Parkinson's is age. The older you get, the more at risk you are for getting this disease. In terms of the age group that is at most risk, most people who get Parkinson's disease are over the age of 60. They're 60 and above. But that doesn't mean that that's the only age group that gets it. I got diagnosed when I was 35, and I know many other people with young onset Parkinson's. So Parkinson's is a neurological condition that affects the brain, and it affects the part of the brain that is responsible for movement. So you see some people with Parkinson's have, it's called a movement disorder, and they have issues with, like you can see, my hands are shaking, I have issues with tremors. Some of the cardinal symptoms of Parkinson's are tremor, rigidity, stiffness. But Parkinson's has over 30 different symptoms. The ones that I just mentioned are things that you can actually observe with the eyes. But there are many other symptoms like anxiety, depression, pain, fatigue, that people are not able to observe, that can sometimes be more debilitating than the actual movement symptoms.
And Omotola, in your case, and I'm guessing in the cases of most of the individuals who do have Parkinson's but aren't aware, what were the first indications that something might have been not quite right? And how did you go about diagnosing and caring for that?
So for me, my first symptoms started in 2009, about 2010, with a slight twitch in the forefinger on my right hand. I didn't pay too much attention to it. I thought it was really, due to stress. But the twitch persisted and got worse. And over time, it went from one, a twitch in one finger to tremor, to tremors in both hands. And then that became accompanied by muscle rigidity, weakness, stiffness. And then I started having a host of different symptoms. In terms of my diagnosis, it took a really long time for me to get diagnosed. It took over 5 years. Partly, when I actually did get diagnosed, one of the doctors that saw me was, actually said to me that, we don't typically see this illness in young Black females. Not that they're not, that there are no young Black females, but, he didn't typically see it in young Black females, which is also one of the, I guess, misunderstandings about Parkinson's, because a lot of people think that it's an old man's, it's an old person's disease, but it's not. There are a number of people like myself who do have young onset Parkinson's.
All right, Omotola, let's talk about treatments. Are there treatments for this particular disease, or is it a terminal disease, or talk to us, or is it a lifetime disease that once you have it, there are no remedies for it?
So thank you. Parkinson's is a chronic progressive disease. You have it for life, and it gradually gets worse over time. There is currently no cure for Parkinson's disease, but that doesn't mean that there aren't treatment options, and there are a number of different management options that people could employ to help them live well with this disease. There, in addition to the medication, there are therapies that people can engage in, like physiotherapy, occupational therapy, that would help manage the disease better.
So how easy is it to get access to all those kind of therapies that you talked about here in Nigeria?
It's not easy, which is one of the reasons why we're trying to raise awareness. I live in the UK. I have access, regardless of a person's socioeconomic status, in that part of the world, everybody has access to, a standard level of care. It's not the same in many parts of Africa. And this is one of the things that we're trying to do with Parkinson's Africa. We're working with different organizations to provide access to medication for those patients who are not able to afford it. Through our collaborations with the FAR Foundation, the World Parkinson's Program, we are currently providing access to over 300 African patients, 200 of which are in Nigeria, with free Parkinson's medication. But accessing not just medication, accessing the right healthcare professionals, accessing the therapies, there are two problems. One, not only is it expensive, it is, but it's not also readily available.
Right. And it's very good that you would come on the show and just try and stir up some awareness for us, especially on a day like today, Parkinson's Awareness Day. We've talked about the treatments and the symptoms. Is there any sort of prevention, or is this a hereditary disease?
There are some cases where heredity is linked to, genetics is linked to Parkinson's disease, but that is not the norm. The vast majority of Parkinson's cases, as far as I'm aware, are idiopathic, are idiopathic, which means they're of unknown cause. What was the second question you asked me again?
I was asking if it's preventable.
Right. So because we don't know what causes Parkinson's, researchers are finding links between, some links between genetics and some links between environmental factors. But because we don't know precisely what causes Parkinson's, it's hard to know what to do to prevent it. But there are some general, basic, common sense things, eating right, exercising, staying away from toxic, harsh chemicals. There are there are some chemicals in the U.S. that they've been able to find a link between exposure to those chemicals and Parkinson's disease. So just trying to stay away from toxic and harsh chemicals will help.
All right, I want to say thank you very much, Omotola Thomas, for sharing a little bit of your story with us here on Newsday. I want to say that certainly there is hope in the future as we hear that China is actually looking for a cure with pea plants. All right, I want to say thank you very much.